Tonight, the number of reportable sexually transmitted infections in the United States is on the rise. The CDC described gonorrhea, syphilis, and chlamydia as a growing threat across the country, including East Tennessee. WBIR 10 News anchor Brandon Bates joins us with why the numbers continue to climb. Brandon?
Well, John, experts attribute these numbers to many different things, and a consistent rise in the population and unsafe sex are the obvious assumptions, but others say budget cuts and dating apps are behind the growing trend.
According to the Centers for Disease Control, over 2 million Americans were diagnosed with a sexually transmitted infection in 2016, more than ever before.
We continue to see rates of STIs to kind of slightly increase.
Those STIs include chlamydia, gonorrhea, and syphilis. And the most common reportable STI in Knox County is chlamydia, with cases growing each year by the hundreds. If you compare all of last year's reportable STIs to just the first 6 months of this year, you can see there are already more cases of HIV, and this year's syphilis and gonorrhea numbers aren't that far off from all of 2017. As far as why these numbers are going up, Dr. Buchanan says unsafe sex is one obvious reason, along with several others.
And those things are being multiply monogamous or being abstinent, using protection when you need to, and getting tested regularly if you have multiple partners.
Other less obvious factors, dating apps. Health experts attribute some of the numbers to how we use technology every day. Gail Boland with the CDC said this in 2017. The way our society is forming partners is now through using a lot of social media, and that is affecting the sexual transmission dynamics we are seeing. The Knox County Health Department director says there are several ways to avoid this.
So making poor choices and therefore ending up with the results of having an STI.
And as far as the budget cuts, the White House's 2018 budget proposed a $186.1 million reduction in funding for HIV, AIDS, viral hepatitis, and STIs. Some say this could bring an even higher increase to the numbers in the future. John?
Brandon Bates with that new perspective.